Welcome to this webinar in support of World Lung Health Day. I'm pleased to invite you. I'm a founder of Teletherapies. Teletherapies is an online pulmonary rehab and mental health services. And today I'm inviting you and expressing my gratitude here for attending this webinar on the Breathing Easy, Your Guide to Healthier Life. And as we all know, the World Health Organization has defined health as a state of physical, mental, and social well being that enables everyone to live a productive life. And this applies to your lung. And I'm going to, in the next 60 minutes, take you through and fill you with the power of knowledge about your lung and some chronic lung disease and how you can manage with some practical tips and some insights about pulmonary rehabilitation, which is still an alien field for most of the people living around in the UK and also around the world. So I hope this session would be a helpful resource for all of you. So let's dive into the session. So why this webinar today? As because there is a highest concern triggered by COVID-19, and even before that, in 2017, England has been one of the major disease, respiratory disease, affects 1 in 5 people and third biggest cause of death in England after cancer and cardiovascular disease. And every year, 700,000 hospital admissions are down to the lung disease. And about 585,000 respiratory disease are made, diagnoses made per year in UK. And most of them are due to asthma and COPD. Lung cancer, pneumonia, and chronic obstructive pulmonary disease are the biggest cause of death. And the NHS spends around 9.9 billion each year on the lung disease. And these are the figures and facts collected from the NHS and the Task Force for Lung from the year 2017 and 2021. And the Task Force for Lung confirms, led by Dr. Noel Baxter, it confirms that 115,000 people die from lung disease each year. That means one person every 5 minutes. So it's a highest priority for NHS now, focusing on the respiratory disease and how to manage respiratory disease effectively to improve the quality of life and productivity in people with chronic lung disease. And what to expect. In this session, I'm going to guide you under these topics to understand your lungs and common lung health challenges and risk factors and the practical tips for healthy lungs and breathing exercises to improve your lung function and insight on the pulmonary rehabilitation, though I cannot cover, it's a very vast topic of pulmonary rehabilitation, so I will be throwing on the insights of pulmonary rehabilitation. And finally, the session is for your question and answer session. So I'm here to answer your questions about your lung health or the pulmonary rehabilitation. So your lungs are the vital part of your respiratory system. And as we all know of the lung functions to inhale the oxygen, and which is the main source of fuel for all the functions in your body, and exhale the bad gas, that's the carbon dioxide. And the key players are the diaphragm. As you can see, this is the dome-shaped muscle there and below your two lungs, sitting inside your chest cavity. And your respiratory system starts from your nose and ends in the diaphragm. And the other key players are the cilia, the air-like structures that is actually along your nasal passages through to your trachea and to the bronchus. And these tiny air-like structures help to filter, and move your mucus and foreign particles out of your airways. And as you can see, your bronchus, which is the continuation of your windpipe entering into your lungs, bifurcates, that branches down as the branches of a tree and then ends up in a bunch of grapes. And these are tiny air sacs where your end gas, the air which you breathe in, lands. And from there, it enters into your bloodstream. And from your bloodstream, from the capillaries which carries the bad gas, then pushes the bad gas into the alveoli, and that's what you breathe out. Now, the facts about your lung. Normal respiratory rate for an adult is between 12 to 20 breaths per minute, but it can increase during your exertion, that is, your increased physical activity. For example, you are running a marathon. Definitely, your breathing rate is going to be higher, and your heart rate is going to be higher as well. And that is normal, and that will settle down within a minute. And for people with chronic lung disease, it might actually take more than a minute. And between a minute and 5 minutes, they might be struggling to get back their breath. And the lung capacity varies among individuals, and normally the total lung capacity is around 6 liters, and it depends on the age and ethnic group you belong to. And the breathing control is your breathing is automatic. We are all gifted with an automatic function of a breathing, but your breathing is also regulated by your brain center, which is the cerebellum, the iron brain in the medulla oblongata. And the other important fact is the lungs are a precious organ in our body. Without lung, even our brain cannot function because your brain needs to fuel the oxygen. So the productive mechanism for your lungs are some of the cough reflexes and the mucus productions. The mucus, which is produced in your inner lining of your respiratory tract, traps in all the foreign particles and prevents infection to affect your lung. And the cough reflex is to push out the mucus, any of the irritants going into your throat that is pushed out. Now, how your lung works. Your lung, which is what we call as a breathing process, we all know we breathe in and we breathe out. But what happens between the breathing in and breathing out is important. So when you breathe in, your diaphragm, which I said is a primary muscle for your breathing in, is contracting. So that means that the dome-shaped muscles pull down, and so then creating a difference in the airway pressure, and also your rib cage expands and creating a vacuum. And then the air, because of the negative pressure inside, the air is actually from the outside entering into your nose and into your airways, into your lung. And then gas exchange happens in your lungs, and there is exchange of oxygen and your carbon dioxide. And then when you're breathing out, this dome-shaped muscle relaxes and your rib cage contracts and then squeezes out all your air out. Okay, that's the normal process which is happening during your breathing. Now, throwing light on to the common lung health challenges, which I'm here going to focus on the common lung diseases, what we all, what majority of the chronic lung disease patients have. Is one is chronic bronchitis. I call this a traffic jam in your airways because the airways, which is actually like the tubes of your airways, is narrowed down due to the inflammatory process. And due to that narrowing down, you're having a shortness of breath. Often you feel breathless, especially during your physical activity. And there is a persistent cough, a chronic cough with mucus, which is an hallmark of your chronic bronchitis. And specifically 3 months of the year, at least for 2 years. And increased sputum production, which means you may notice an increased amount of mucus as you cough up. And wheezing, which means then your wheezing sounds during the breathing can occur due to a narrowed airways. Now, there is also, because your heart and lung works together, there is also your increase in your heart rate. That's tachycardia. We call it as a fast heart rate. Normal heart rate is between 60 to 100 beats per minute, and that might be increased in case of chronic bronchitis. Now, the next condition I wanted to introduce you to is the deflated balloon. The deflated balloon means that's the alveoli, which I said that's the bunch of grapes, which is called the alveoli. And those alveoli needs a protein called alpha-1 antitrypsin to maintain its elasticity. And this protein is very low, the deficiency of the protein. and so the elasticity of your air sac is lost, and it's like a balloon without hair. So that's why it's called deflated balloon. And people with this condition again share the common symptom as chronic bronchitis, like shortness of breath, chronic cough again, but some individuals are less pronounced cough, and barrel chest, which is like your chest cavity becomes barrel shaped because of the loss of elasticity in your lung tissues, which is called parenchyma, and limited exercise tolerance. You might be feeling very tired, not able to do your normal activities of daily living. And the other condition is bronchiectasis. Bronchiectasis is, again, I mentioned about the bronchus, and those bronchus are inflamed, and that is the bronchioles. So, from the main branch of the bronchus, inside there's a bifurcation, the branches, and those branches are inflamed, and so there is a stagnation of mucus, and the mucus is not able to be pushed out, and this creates a zone of infection in the lung. And so people with bronchiectasis are more pronounced for chest infection. And so again, they share the same symptoms like shortness of breath, persistent cough, and increased sputum production, and wheezing and tiredness. And then there is a lung infection, and as with COVID, there is also a prolonged lung infection, and the tissues in your lungs affected. And as a result of COVID, there is also stiffness in the lung tissue, which is leading to pulmonary fibrosis. And people already having COPD or emphysema have an increased severity of reduction in their lung capacity and volume. Now, there is another condition which I would like to introduce. We're all aware of the asthma with the trigger of allergens. Your airways get inflammation, and there's a temporary inflammation, narrowing down of the airways, and wheezing. We're all familiar, and there is a childhood onset of asthma and adult onset of asthma. But in COPD, there is an overlapping component of asthma as well. So because ages back, people have been labeled asthma, then later found to be discovered having COPD or emphysema. Both this asthma COPD overlap syndrome share the same symptoms like coughing, wheezing, shortness of breath, and chest tightness. Now, the risk factors for lung health issues. So, common risk factor for your lung disease, for example, the chronic bronchitis or emphysema or asthma, the triggers are the majority of the reason is smoking. Yeah, and the other triggers are the environmental factors like air pollution, secondhand smoke, and radiation. And aging is another risk factor. As we age, our lung capacity reduces by 1 ml every year after the age of 25 to 30. And there is also a contribution of genetic factors like alpha 1 antitrypsin deficiency, where I earlier mentioned that is a cause of emphysema, a lung condition called deflated balloon. Now, what are the treatments? The treatment aims to relieve the symptoms and slow your disease progression and improve the quality of life. The common treatment approaches, a majority of them is medication, where majority of the medication was inhalers. You would have all seen some people having their blue inhalers in the park or the school. So that is actually a short-acting bronchodilator, as the word specifies, is bronchodilations to dilate your airway. So those are temporary dilations. So it's not the permanent cure for your lung disease. So the like diabetes, if you have a chronic lung disease, it can be managed. It cannot be completely cured. Yeah, and so you cannot regain the lung capacity or the volumes which you have lost, but you can actually prevent the damage happening very soon. So you can prolong your quality of your life, and you can live your life more productively. And so it's about living in the present moment in a healthier way. And then the support other medications, other medication, because oxygen is also a drug. So it's oxygen therapy for people who are falling under the severe stages of the chronic lung disease. And very important management is the pulmonary rehabilitation, which I need to throw more insights here, because pulmonary rehabilitation is a one-stop shop, and it's a comprehensive program where it focuses on the management of your lung disease, and also focuses on the behavioral change. Why I say it focus on the behavioral change is because, as I mentioned, the primary cause is smoking or inactive lifestyle, air pollutants and chemicals affecting your lungs. So that is going to be pulmonary rehabilitation, which I mean by that. So that pulmonary rehabilitation is going to be a one-stop shop where a multidisciplinary approach is thrown on managing and supporting your chronic lung disease. And the other treatment options available for chronic lung disease is the lung transplant. So people with the severe lung disease, who had lost their elasticity and were more younger, in a more younger category, there is also an age limit for lung transplant. So people are then actually put forward for the lung transplant in those situations to support them with a healthier lung. Now, I've mentioned about the tips for healthy lungs. So let's dive into that tips for healthy lung. So the practical advice, what we always recommend for your chronic lung disease management is regular exercise. Be an advocate for your healthy lifestyle. And as smoking is a primary cause for your lung disease, do not smoke. Try to wean from smoking. So I understand you cannot quit your smoking like a cold turkey, but it is important that you understand the impact of the smoking that causes damage to your lungs and to the lungs others here around you. So that is very important that you consider for yourself and for others to wean from smoking slowly, and then go to smoking cessation programs, which is widely available nationwide. Or some people even try the smoking cessation by themselves by going to counseling session. Because smoking cessation program is a counseling and medication with support from a specialist nurse who runs the smoking cessation program regularly around the county, across the nation. But if you're not willing to go into a group session, if you're not willing to be labeled and be embarrassed to join a group session in the smoking cessation, you can very well approach a one-to-one counseling session and take support to wean from smoking. And then stay hydrated is very important, because I mentioned that the mucus production is increased and the mucus get thickened and also forms a zone of infection. So it's very important that you need to stay hydrated, and so drink loads of fluids. When I say hydrated, it's not about drinking 5 to 6 cups of coffee in a day. It's about drinking pure water or fresh juices to keep you hydrated. And so we're looking into the healthy ways of maintaining your hydration. And then be kind to your mind. It is very important that this breathlessness is causing you to get more anxious and depressed. And it's very important to focus on some meditation and mindfulness activity if you're going through this chronic lung condition, and to help you to support to maintain a healthy lifestyle. Now, the other practical advice I would recommend is avoid air pollution. So try to wear a scarf or in a polluted area to avoid inhaling all the fumes. Or if you're around a person who's smoking, stay away at least 6 meters away from people who are smoking, to stay away from the secondhand smoke, which is going to be a risk factor for your lungs. And stay updated to vaccination. We recommend people with chronic lung disease to stay updated with the flu vaccine every year. And now with the COVID outbreak, we recommend people to stay updated with all the COVID booster doses to keep you safe. And the other final practical advice is maintain good hygiene. Your personal hygiene, your oral hygiene, your sleep hygiene, and your food hygiene. Apart from that, also when you're coughing and sneezing, try to use a tissue and cover, so that your infection, the air particles are not spreading around. And so that's very important. And after coughing or sneezing, or after coming in contact with any of the foreign bodies like the door handles or any other infected person, try to wash your hands so that you're keeping safe yourself and others. That will prevent the spread of any infection. Now, breathing exercise. In this segment, I would like to throw light on there are many breathing exercises, but I'm going to take you through the four different breathing exercise which might benefit your lung function. The first one is the diaphragmatic breathing, 4-4-4-4 breathing, which is also called as box breathing. And the second one is the pursed lip breathing, 2 and 4. And the third one is how to do huff coughing. This will help you to support to clear your secretions from your lung. And the final one is the Dirga breath, which is also called as three-part breath. And it's a part of a pranayama technique, and I'll be throwing some light on that. So, as I said, the diaphragmatic breathing, if you're ready, sit or lie down comfortably. Inhale through your nose for a count of 4. Hold your breath for a count of 4. And exhale slowly through your pursed lip for a count of 4. And pause for a count of 4 before beginning the next cycle. And repeat it again. So I have also demonstrated in one of my YouTube videos. If you check out my Lung Mind channel, I have described this box breathing very clearly. So this breathing helps you to improve that a deeper inhalation and your oxygen reaching the deeper parts of your lung tissues, and giving prolonged time for your gas exchange between your air sac and your blood vessel, and also breathing out all that excess of the bad air that's trapped in your lung. So that's diaphragmatic breathing. Now moving on to your pursed lip breathing. It is a 2 and 4 breathing. Again, pursed lip is a technique to provide some resistance or the pressure to keep your airways open. Because as you're breathing in and breathing out, breathing in 1 or 2 seconds and breathing out 1 or 2 seconds, a fraction of second you're giving for your gas exchange internally in your lung tissues. So to improve your oxygenation, most of our adults, even without chronic lung disease, we are having a shallow breathing. So we need to at least incorporate once in our daily practice a pursed lip breathing, 2-4 breathing, where you breathe in through the nose and exhale gently through your pursed lip, like pursing your lip, making an O shape in your lip, letting that air out slowly for longer than you breathing in. So that's the reason it's 2 and 4. So breathing out twice as much as you breathe in. Okay, that's pursed lip breathing. And let's now move on to the third technique, that is the huff coughing. Why this huff coughing? I mentioned about chronic bronchitis or bronchiectasis. There is a loads of secretions that is filled deep into your lung tissues. Okay, and you need to clear that secretion. So it's called bronchial hygiene or your lung hygiene, because we don't want a house to be contaminated with all the waste for 2 or 3 days in the bin. We actually empty our bins every day. It's like emptying our bin on a daily basis is to empty all the waste products, that is the congested mucus with all the infected products out of our lung to keep our lungs clear and healthy. How do you do it? Is inhale deeply through your nose and then exhale by leaning forwards and sharply, like 3 huffs. So breathing in deeply, leaning forwards, and contracting your abdominal muscles and doing. So it clears, it pushes your mucus up and clears, bring it up to your throat. Once you feel your mucus in your throat, and you cough it out. Okay, that's the technique helpful for people with congested lungs. And Dirga Pranayama, the three-part breath, again, it is the normal way what an individual should be breathing, but we are incorporating in this pranayama as a pranayama technique to be done because we are all got used to shallow breathing. So in this breathing, as I mentioned, the three parts is about start filling in your abdomen first, and then your ribs for second, and then your upper part of your chest cavity third. So breathing in, filling in your abdomen, your ribs, and your the part of your chest. And now, while you're breathing out, reverse. Okay, so breathing out the upper part of your chest cavity and contracting your ribs and tucking in your tummy closer, drawing your abdomen, your belly button closer to your spine, and breathing out all that excess air. So, practicing this for 15 minutes on a daily basis is a good way of maintaining a healthy gas exchange in your lungs. Now, as I mentioned earlier, throwing insights into pulmonary rehabilitation. So, pulmonary means lung, and rehabilitation is rehabilitating your lung. And when you actually in having any chronic lung disease, when you go to your GP, initial advice would be you'll be provided with some inhalers to see whether you're able to cope with your inhalers. And later, if your symptoms are recurring on the yearly basis, then your GP or your consultant would refer you to a spirometry test, which is a lung function test, and then they measure your lung function, where does your lung function falls, and depending on the stages of your severity of lung function, they refer you to your pulmonary rehabilitation, where it is then confirms that you need a daily maintenance of your lung with the support from a professional help. Okay, so most of the referrals now happening are based on this spirometry in the severe or moderate cases, and the mild cases are not referred for pulmonary rehabilitation. But the research has confirmed that it is very essential to take the preventive steps even in the mild stages of your lung condition. You need to start enrolling yourself in pulmonary rehabilitation. As I earlier mentioned, the NHS has focused respiratory disease as a main concern, and to improve the health of people with chronic lung disease, pulmonary rehabilitation has received a huge funding to be established in the local primary care and health centers. But still, this is not in practice, although the work is ongoing, and the ratio of pulmonary rehabilitation is not sufficient for the local population. So it would be wise for you to contact your GP and get to know where is your local pulmonary rehabilitation center that you can go and enroll yourself if you have symptoms of chronic lung disease. And pulmonary rehabilitation doesn't need a GP referral. For your information, if you have been diagnosed with any of the chronic lung disease and you feel that you're not able to cope with your symptoms, do get support from either a private pulmonary rehabilitation or NHS pulmonary rehabilitation support. Don't wait too long. So, pulmonary rehabilitation, as I mentioned, it improves your lung function and it enhances your physical fitness and it improves a better quality of life and your emotional well being. And research has confirmed this evidence, and it is actually a comprehensive program. As I'm taking you back to this slide, where it is a multidisciplinary approach: a physiotherapist with respiratory specialty, a consultant with respiratory specialty, a nursing staff with a respiratory specialty, a dietitian, a psychotherapist, and social care worker. All of them come together to deliver the care for people with chronic lung disease, and that is what pulmonary rehabilitation is. Now, I would also like to throw some light on the resources for support in the local contacts in your in people who are living in UK. And as you can see on the screen, your local NHS website has a lot of information around your chronic lung disease and what are the supports within your reach in the NHS. And this is the link which I've put on my screen there, www.nhs.uk. And British Lung Foundation, again, is a charity organization dedicated to deliver pulmonary rehabilitation, and it all delivers in the form of advice or the local support groups and educational materials. And I also put that blf.org.uk link over there. And your local respiratory clinics, which is your GP, also have a specialization in your chronic lung disease. So you can request, if you don't feel that your GP is focusing on any of your pulmonary rehabilitation, please do talk and request for pulmonary rehabilitation if you wanted a support for pulmonary rehabilitation. And there are a lot of patient support groups locally in your community. So reach out for the support, and your local surgery or the GP center would be the point of contact, or the citizen information center would be a point of contact to avail those services. And the COPD patient passport is also one of the quality improvement thing. People with COPD are given this passport who are under the management of the NHS care, and where they document their symptoms, and so that they can be progressed whether the management is responding to their condition. And pulmonary rehabilitation program, as I mentioned earlier, teletherapies also offer pulmonary rehabilitation. And with the COVID outbreak, teletherapy offers online pulmonary rehabilitation with an integrated mental health support. As I earlier mentioned, that people with chronic lung disease have anxiety and depression. We at teletherapies focus on managing your mental health condition as well, alongside your chronic lung condition. And people with asthma, there is support of resources from Asthma UK, and the link is on the screen, asthma.org.uk, so you can reach out for more resources there. And British Lung Foundation helpline, the contact line is on my website and also on the screen here, so you can look into support for the BLF helpline if you're struggling with your lung condition. And British Lung Foundation also offers a chatbot, so you can avail some resources from the chatbot help. And the people with chronic lung conditions have is it go to a stage of disability at one point if they are suffering with severe stages of lung function. And for those people, and they are not qualified to work. So for those people, then the benefits and the financial support are available from the UK governments. And I put that link over there, and you can browse for the benefits if you qualify one for that. It's www.gov.uk browse slash browse slash benefits. So you can go to that link and avail those services. Now, teletherapy also focuses on equity care. And as I mentioned, there is a highest concern, and UK and England is the third biggest cause of death from the respiratory disease, majorly from COPD and asthma. We don't know whether the South Asian get that care, and the data that they collected, does it involve South Asian group of ethnic minority people? As health is equal, and equity care should be provided to everyone. So teletherapies now offers this survey to collect the knowledge awareness about pulmonary rehabilitation among the South Asians, so that we can tailor support for the needs. As I earlier described, pulmonary rehabilitation is a one-stop shop, and it's more of an exercise education and supervision program. And for that, you need to be aware of whether the group South Asian minority group is well aware of this support. When is the support provided? At what stage they are becoming aware of it? And what ways of modification can help them to retain the benefits of pulmonary rehabilitation or consistently maintain the advice? So that's the focus of this survey. So I will put a plea out there in this webinar on this World Lung Health Day. If you could scan the barcode, and this survey barcode is also on my website, www.tele-therapies.org. So I would ask you to take an initiative to spare that 2 minutes to fill in the survey. It's a very simple survey with 10 questions on it. Now, thank you for listening to this webinar, and I would now open the session, the platform for more questions. While you're thinking about your questions, so there is actually some questions I would like to refer here. The first thing is people have queries about if I'm having COPD, and I'm also having some other conditions, whether I'll be qualifying for pulmonary rehabilitation. Yes, chronic obstructive pulmonary disease has comorbidities. People with COPD have been diagnosed having other diagnoses like diabetes or irritable bowel syndrome or heart disease. You're very well open for to enroll yourself in pulmonary rehabilitation because it's going to benefit your other conditions as well. Because active lifestyle and instructions about managing your diet and other supportive measures about your medication is very much needed to support your body function as a whole. And also, pulmonary rehabilitation supports mental health therapy. So it is very important that you enroll yourself in pulmonary rehabilitation if you have a chronic lung disease so that you can attend both your lung and your mental health. I'm still waiting for the questions. So it looks like people are not having any questions. Let me give another few seconds. While I'm waiting for the questions, I'm going to remind you here that's on the screen. Teletherapies offer a free 30 minutes consultation, so you can actually avail those services on the teletherapies website. And you can either contact in the website, there are contact details either via email or the phone. And either way, please do reach us, and we are here to help you and support you to live your life in a healthier way and maintain your lung health. As I have no questions so far, so I am bringing this session to a close, and I would like to express a big thank you for sparing your minutes here for this webinar. And please do spread the lung health to your friends and network. And I'll see you in the next webinar, and have a good day.